Are you pregnant? Congratulations. A very auspicious time. But what is the most important test that you should get done? I would say this would be blood sugar, which affects both mother and the child in later part of the life also. Hi, this is Dr. Richa Chaturvedi, Senior Consultant Endocrinologist at Indraprastha Polo Hospital, Sarita Vihar, New Delhi. And in this session, we are talking about diabetes in pregnancy. So there are two ways that one can have diabetes in pregnancy. One is you were already having diabetes and this was carried over in pregnancy. Other is you did not have diabetes earlier, but you developed during pregnancy, particularly in later part of pregnancy, which is a mild type of diabetes. We call it gestational diabetes mellitus. Pregnancy by its nature is a diabetogenic state. Everybody has increased blood sugar level in pregnancy. Like a woman who does not become diabetic during pregnancy, but if we compare the levels, her sugar levels would be higher than the levels which she had before pregnancy. And why are levels high in pregnancy? There is this thing called placenta which connects baby and mother. It makes certain hormones like HPL, human placental lactogen, which increases blood sugar level. As the pregnancy increases, the size of placenta increases, the quantity of this hormone increases, and the sugar levels increase. And if we are not controlling sugar levels well, there may be harmful effects on the pregnancy, on the outcome of pregnancy. There may be, more risk of pregnancy loss, stillbirth, congenital malformations in the baby like spinal deformities, and neonatal respiratory distress. There may be, large baby size, what we call macrosomia, where there would be a difficulty in delivery, in taking the baby out. So there may be various problems associated with high sugars in pregnancy. There are very tight sugar levels that have been recommended to maintain, which are tighter, stricter than in a non-pregnant individual, because this is so important. So as soon as you are detected with pregnancy, the first test is go for your fasting blood sugar level, and then there is a test called glucose challenge test, where they give you certain amount of glucose, 50 grams of glucose, and then 1 hour later we check sugar levels. And depending on your sugar levels, we decide whether you are at risk of developing diabetes or not. When we are trying to confirm the diagnosis, we do proper GTT, done with 75 grams of glucose. We check your sugar before giving you glucose load, then at 1 hour, then at 2 hours. And we have different cutoff levels based on which we diagnose diabetes. It is very important to control sugar levels for smooth outcome of pregnancy and smooth carry on of pregnancy. Generally, gestational diabetes mellitus is mild and it can be controlled with diet in most of the cases. Sometimes people require insulin. But if you were having diabetes, from the beginning, like even before becoming pregnant, then generally that tends to be a little more severe, and we don't give oral tablets during pregnancy because they generally cross placenta and reach the baby. But insulin does not cross placenta and does not harm the baby. So we prefer giving insulin injections in pregnancy if required. And as I said, there are very, very, very strict levels that we maintain for, to avoid any harmful effect in the baby and the mother. And gestational diabetes mellitus, it's a kind of, stress to the body. If a woman has developed GDM once, that means this person is more at risk of developing diabetes later on. A woman with GDM has 10-fold increased risk of developing type 2 diabetes later on. That is why when a person with GDM has delivered a baby, we call the patient again in maybe 1 month, sometimes in 3 months also, 4 to 12 weeks. And we do a proper OGTT, oral glucose tolerance test, where we give 75 grams of glucose and then check before giving glucose in 1 hour and 2 hours and see whether the patient's sugar levels are rising or not. If these are not normal, then we give advice in terms of diet and tablets if required. But if these are normal, then patient is not given green signal. Patient has a lifetime risk of having type 2 diabetes. So we check sugar every 1 year and sometimes every 3 years. So we have to keep doing that in a woman who has developed diabetes during pregnancy.